Welcome back to the podcast, It's Not You, It's PCOS. Today we are diving deep into how IVF and fertility treatment can look differently for those living with PCOS.
And we are joined again by Dr. Jenny Cook.
Hi.
Thanks for coming along, Jenny.
My absolute pleasure. I'm really looking forward to what we're going to talk about today. It's such a common problem.
So Jenny's going to help us unpack everything from hormonal imbalances to metabolic health to ovarian hyperstimulation risk and what you can do about it.
Let's do it.
Before we dive into that, I think it would be amazing if we can just bust this myth. So there's this myth that women with PCOS can't conceive without IVF. Dr. Cook, can we bust that one?
We can bust it. That one is completely busted. Polycystic ovaries is a spectrum, right from women who have very mild polycystic ovaries to women have a more severe form of it. But as always, fertility is related to a woman's age. And younger women with PCOS can fall pregnant easily. Often, I won't see them until they're planning their second child in their 30s and they're having problems. And then I say, you've always had polycystic ovaries, but it's become a clinical problem now because of your age.
That's fantastic. I hear women being really afraid upon diagnosis about their fertility, that they are, in fact, not going to be fertile. So it's really great to put that out there again, that it's absolutely possible, and more of an issue is the age. Yeah, I think, women who have PCOS should know that diet and lifestyle is first-line intervention. And we know that we've talked about the Mediterranean diet in a previous episode, how helpful that can be for fertility, but particularly for women who are going through an ovulatory issues. So if they're not ovulating, we know the Mediterranean diet can assist with that, even up to 69% by making just 5 simple dietary changes. So,
no, absolutely. It's all about dropping your insulin resistance, and that's tied in with your weight and the amount of exercise and your 5 special dietary tips.
Yes. Yes, it is. Yeah. So I think, it's important to talk about PCOS holistically. And, Nick and I often see clients for ovulatory dysfunction. But Nick, we know that it's a full body metabolic condition, right? It's not just,
yes.
We're not just talking about issues with ovulation. It's a whole body condition.
Yeah, for sure. And Jenny just touched on insulin resistance or insulin before. And the body's absolutely fascinating how hormonal imbalances can lead to changes in the way that we process our carbohydrates and our glucose, and then some of the clinical signs and symptoms that we get with PCOS as well, like acne and hirsutism or hair growth. So, Jenny, how do you think the metabolic side of things impacts fertility treatment success?
That is a very good question. The way that these women process carbohydrates is impacted, and it's actually thought that one of the primary triggering factors is an increased insulin resistance. And if you can bring that down, you can actually achieve more regular ovulation. So that's the first thing. The second thing is these women often do have problems losing weight because of the way they're processing carbohydrates, and that impacts the way, if we are to go down the IVF pathway, and I have to stress we don't always go down the IVF pathway, but if we do, that affects the metabolism of the hormones that we give, and it can often have a negative impact on my ability to stimulate ovaries and the number of eggs that I can ultimately collect. It all comes back to what we're always saying. Diet, lifestyle is absolutely critical to have a positive impact on natural fertility, but also if you go down the pathway of fertility treatment such as IVF, it's critical to have a positive impact on that as well.
Agreed. So when someone with PCOS needs that extra support to conceive, how do you approach fertility treatment? Is it straight to IVF or other treatment options that you consider before that?
So we always talk about diet and lifestyle to start off with. They should be an ideal, so the body mass index, the BMI, is the weight that a woman should be according to her height, and it should be 20 to 25. Women who are over 30 are in the obese range, and that can have a negative impact on ovulation. It may be a simple matter of losing weight, and that can obviously be a lot of hard work, but it could potentially lead to a natural conception. The second thing would be looking at a woman's age. So a woman who is in her 20s or early 30s with irregular ovulation, if the lifestyle measures isn't adequate to achieve regular ovulation, we can actually go down the pathway of what I call ovulation induction, which is, in simple terms, giving something to support the process of ovulation every step of the way. I would firstly make sure the tubes are open. We do accurate ovulation tracking to make sure that all the hormonal levels are being reached, and we ensure that they're having correctly timed intercourse within about 24 hours of ovulation. If they are generally after about 35, they will do a lot better with an IVF program. There's no rule to say that we can't start off with ovulation induction, but I do see a lower pregnancy rate in that particular age group in women with polycystic ovaries.
So it sounds like there's multiple options for people living with PCOS.
Yeah, definitely. IVF is absolutely not first line. Yeah.
All right. So, Jenny, we hear about this thing called Ovarian Hyperstimulation Syndrome. Now, women with PCOS are apparently at greater risk. How would you approach this in particular?
The key rule is to be gentle with ovaries. You've always got to be gentle with ovaries, but especially gentle in women who have got polycystic ovaries. And I'd explain it. So on ultrasound, we just see lots of little follicles in the ovaries, which are just sitting there ready to release an egg. They're all ready to go. But generally that trigger for them to ovulate on a regular basis is lost. If I need to come along with very gentle stimulation so I don't create an explosion, and really that's what hyperstimulation is. When all of those follicles are activated, they all start getting increasing in size, maturing an egg, and the estrogen goes up. That leads to the syndrome of hyperstimulation. The absolute key is to be gentle with the ovaries. And without getting too technical, the dose that I would use is determined by their age, their body mass index, and certain features of their ovaries. There's a blood test that we do called an AMH, and on the ultrasound, looking at the number of follicles, so the antral follicle count, and I can have a very good idea about a good starting point for the dose of their stimulation.
That sounds so insightful. I think not many women with PCOS really know what to expect, and it's so great that we can highlight BMI and we can highlight insulin resistance. These are key drivers, and weight can exacerbate the symptoms of PCOS. And we touched on it earlier that diet and lifestyle is first line treatment for PCOS. But I guess, if someone's struggling with weight and they're trying to go through the fertility journey, it is, again, great to know that if they do implement these changes earlier.
Oh, it makes a difference. It makes a difference.
And there's more than one way to achieve their goals, whether it's weight or improving insulin sensitivity. We do know that adopting the Mediterranean diet is the one that's most well known, but we do have other research showing a low GI diet, a supervised ketogenic diet for a short period of time can be helpful as well in improving insulin sensitivity, lowering inflammation, improving body fat composition, and when that can have a positive impact
Absolutely.
on hormonal health. Yeah.
No, absolutely, absolutely. You need to have made those changes ideally before you come along. And in fact, there would be situations where you make those changes and you don't need fertility treatment. But the success of anything that medical science can offer is only going to be improved in a woman who is really making the effort to address her own lifestyle. And I just have to stress again, a woman who is overweight or obese is setting herself up for complications during a pregnancy, and this also can contribute to the health of the baby and then the subsequent adult later on, as we know. Diet and lifestyle I can't stress how important it is.
Yeah, I'm so happy to hear you say that. I mean, we say it all the time, but it's just nice to hear it.
Extra validation.
Extra validation, absolutely. You know, lots of women do struggle with insulin resistance going into trying to conceive. That is an underlying problem. And if we can tackle that, we can improve, you know, their fertility, but also reduce risk of gestational diabetes. We can reduce some of that risk because that is a pregnancy,
all of that
complication. Yeah.
Not to mention the actual individual or the adults trying to conceive. It's such a fantastic opportunity to alter their own health trajectory. So they've got that added motivation to want to have a baby, but all of a sudden the things that they're doing is actually helping them to prevent disease further on down the track when they get a little bit older.
Absolutely, absolutely. Can I ask a question now? I am not a fan of Mounjaro and Ozempic. Is this something you talk about? I am not a fan of it. I know that it's got a role to play. My concern is the side effects and that it's, I'm going to say, creating a false economy. And then when it's discontinued, the underlying issues will reemerge. Whereas if you've put in the hard yards by addressing diet and lifestyle, you're going to get longer term effects.
Yes.
Comments.
Yes. Go, Nick, you're dying to say something.
Yeah. Me. So I agree. And if we know that our patients need to, if they do go on like a GLP-1 inhibitor like Mounjaro, we know that they have to come off it before they do any fertility treatment. So what is it, Jenny? Is it 6 weeks or 4 weeks?
Our particular unit says 2 weeks before an egg collection. We do it under very light sedation, and we've confirmed that with the anaesthetists. But the safety of these, like, no one's going to recommend it during a pregnancy. We don't know about the safety of it in that situation.
So my concern is what are we doing by losing a whole bunch of weight in the lead up to fertility treatment, then getting a positive conception through the treatment, but then we've actually come off the medication, say 2 to 6 weeks, depending on the IVF clinic. Now we've taken the Band-Aid off. And have we actually solved any of the underlying issues? And so typically the patients are more likely to put on weight during pregnancy, which is a critical epigenetic or genetic programming time where we're essentially, if we're putting on more weight than we normally would, are we genetically programming our kids to be overweight or obese?
Yeah, that's really interesting. That's really interesting. Yeah.
Oh, sorry, Jenny, go on.
I just want to say one other factor, something that I see, and I'm sure you both see it very frequently, is women who do failed cycle after failed IVF cycle after failed IVF cycle without anyone saying, let's press pause and work out, why is this not working? What can we do differently? And like the critical thing is as we keep saying, it's diet and lifestyle. Yeah.
That's such a good point, Jenny.
Yeah.
Yes. I I mean,
for men and women, men and women.
Nick and I experience this quite often in practice, where women are coming to us and couples are coming to us at the end of a treatment failing and then scratching their heads thinking, what else should I be doing or could I've done? And then we start working on the diet and lifestyle. And at that point, I'm like, oh, I wish that we all could have done this a lot sooner. And yeah, it's great that we are sort of trying to get that message across, that the earlier, the better.
Yeah.
Yep. Not only for now, but like I've been saying, and you've been saying as well, for the pregnancy, for their lives beyond pregnancy, and for the health of the child as well.
Yeah, cool.
Yeah.
So I guess there's a bit of a common theme here that diet and lifestyle is really important, which is great for dietitians like myself and Laura and all the other fertility dietitians out there that we get so much pleasure from working alongside fertility specialists like you, Jenny, and like you say.
I will pick up the phone, I will ring. I think I've said this before, I will talk about the individual, the man, the woman, or the woman by herself, or two women, and talk about what's happened and what we're trying to achieve, what the particular strategies are going to be, and we all work on it together. And I make sure they've got regular review. This is in the process that we're pressing pause. This is in the lead up to doing something after about 3 months.
Yeah. Fantastic. And just so glad that you brought up the case of Mounjaro or Ozempic. But I've seen a lot of people trying to conceive go on really restrictive diets as well, and where they do lose a lot of weight, but they're also not at all achieving the nutrient intake that they should be achieving to optimize their fertility. I see, what's that shake? OptiFast shakes, where you're consuming one shake for breakfast, lunch, and dinner, and no food at all. And the same can be said in terms of that genetic programming effect that I talked about before. If you lose a whole bunch of weight, then you get off the shake or the restrictive diet just before fertility treatment. That's also potentially not going to be a great thing for genetic programming.
Yep, very, very, very true. Yep.
Sorry.
Yeah, we definitely want to make sure that the diet that you adopt prior to conceiving is going to be
potentially lifelong
and nutritionally adequate, that we are looking for optimizing the quality of the diet, and as well as filling any gaps that we can foresee, if there's any deficiencies or suboptimal ranges that we can improve, like particularly iron. We see that quite often. We want to put people in the best state to conceive, not just looking at those short-term goals, because it often does mean that, women are already struggling, particularly with PCOS, with making food choices and restriction. And the transition is really hard, and particularly if weight gain then reoccurs in such a short
it's
period
depressing
of time.
And there's a tendency to just, I can't do this, I give up.
Yeah.
Which is not what we want, not at all.
So there's definitely a better way to go about this. And, it does take a village to raise a child, but it also takes a village to conceive a child. You want to have a supportive team around you where you're getting expert advice that helps you make an informed choice.
Decisions,
good decisions that's going to work with your lifestyle, that's individual, and it's not, something that's going to mean lots of unnecessary changes. We want people to focus on things that are actually going to improve their health and fertility, not just, pick up random supplements from the chemist, which Nick and I often see people on, and we're like, why was this recommended? Oh, no, I just thought it was a good idea. And, then walking people back through
can have
that.
A role. And I'm sorry, I'm cutting across you. Supplements can have a role, but the primary thing you need to do is address what you're putting into your body, like just your nutrition and levels of exercise.
And as I always like to say, I feel like I'm back at school again, putting my hand up to get to talk. As I always like to say, you can't out-supplement a crappy diet.
Wow. I like that. I'm going to use that myself. You can't out-supplement a crappy diet.
Yeah.
I love it.
Yeah, that's good stuff, Nick. Love that. I will add, though, with PCOS, there are lots of evidence-based supplements that can assist the process and assist with insulin sensitivity. So we have talked about inositols before on the podcast, I believe. So there are inositols and omega-3 fatty acids. There are lots of other things that we can use, but the best thing is going to be, one, getting a nutrition assessment and really tailoring that supplemental advice to your needs to make sure that they're going to have an impact. And that's essentially what we're trying to do. We're trying to improve your health and well-being in a targeted and evidence-based way.
Fantastic.
So all this doesn't have to be overwhelming, and you can just take one step at a time, and you don't have to build Rome in a day and all that kind of stuff. So if anyone's feeling overwhelmed out there, then don't. Sometimes the best way to go about it is just to choose one thing, work on that, and then build from there. But Jenny, is there, in terms of PCOS and preparing for IVF, have we covered everything, or do you have anything additional you want to add?
Look, I don't. I think the main thing with PCOS is that we need to focus on the weight. That is quite a common theme with PCOS, and not to become too depressed by it, but like you say, just to take one step at a time. I think we've covered everything, but the weight would be the main thing that I would see as a very important endpoint.
Okay, well, that's a wrap for today's episode, Jenny.
That's a wrap.
Thank you for bringing us your wisdom to not only this episode but also our previous episode, and we hope to get you on again sometime.
I'd love to. I've really enjoyed talking to you both, and I'm sure that your listeners as well have taken away a lot that they can use in their own lives. Thank you for the opportunity.
Thank you, Jenny. Thank you so much.
Bye-bye.
Bye,
Bye-bye.
guys.
Bye.
Bye.